Welcome friends, today we'll discuss about cardiac catheterization. This involves passing a specialized catheter through a peripheral vein or artery into the heart under X-ray guidance. Cardiac catheterization allows BP and oxygen saturation to be measured in the cardiac chambers and great vessels and is used to perform angiograms by injecting contrast media into a chamber or blood vessel. Left heart catheterization involves accessing the arterial circulation, usually through the radial artery, to allow catheterization of the aorta, left ventricle, and coronary arteries. Coronary angiography is the most widely performed procedure in which the left and right coronary arteries are selectively imaged, providing information about the extent and severity of coronary stenosis, thrombus, and calcification. Additional anatomical, intravascular ultrasound, optical coherence tomography, or functional pressure wear assessments are sometimes used to define plaque characteristics and severity more precisely. This permits planning of percutaneous coronary intervention and coronary artery bypass graft surgery. Left ventriculography can be performed during the procedure to determine the size and function of the LV and to demonstrate mitral regurgitation. Aortography defines the size of the aortic root and thoracic aorta and can help quantify aortic regurgitation. Left heart catheterization is a day case procedure and is relatively safe, with serious complications occurring in only approximately 1 in 1,000 cases. Right heart catheterization is used to assess right heart and pulmonary artery pressures and to detect intracardiac shunts by measuring oxygen saturations in different chambers. For example, a step up in oxygen saturation from 65 in the right atrium to 80% in the pulmonary artery is indicative of a large left to right shunt that might be due to a ventricular septal defect. Cardiac output can also be measured using thermodilution techniques. Left atrial pressure can be measured directly by puncturing the interatrial septum from the right atrium with a special catheter. For most purposes, however, a satisfactory approximation to left atrial pressure can be obtained by wedging an end-hole or balloon catheter in a branch of the pulmonary artery. Swan-gauge balloon catheters are often used to monitor pulmonary wedge pressure as a guide to left heart filling pressure in critically ill patients. This is the left anterior descending and circumflex coronary arteries with a stenosis, the arrow, in the left anterior descending vessel. A is a coronary artery angiogram. B diagram shows the vessels and branches. Here is the diagnostic catheter. Left main stem artery. There is a stenosis in left anterior descending artery, the circumflex artery. Thank you friends.